afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. Ali Oromchian is our speaker today. Ali is a renowned employment attorney as well as co-founder of HR for Health. At any point during the webinar, if you have questions, please type them into the Q&A section of your control panel, and we'll answer them live at the end. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. And this webinar is sponsored by Henry Schein's Dental Business Institute, as well as HR for Health. Ali, welcome back.
Thank you, Adam. Hi, everyone. Welcome back to the webinar. We've got so many of you, registered, and I even took out all the stops and put on a vest for you. And so my first winter vest. It's pretty cold where I am right now in Northern California, but it's nice to be here, and it's nice to be able to do this for you as we're going to provide another update on what's happening with obviously COVID-19, the vaccines, the FDA approval, your obligations to your employees and the rest of your team and patients. So we're going to go through a lot of material today in a short amount of time. As Adam mentioned, please make sure you put down any questions you have in the chat box, and at the end we'll try to get to them. And if we don't get to all of them, we'll make sure to get back to you individually with some answers. But I want to start off by really talking about a couple of things. One is, I know this is a very kind of emotional topic regarding whether to get the vaccine, not get the vaccine, whether you should be required to be vaccinated, whether your team should be required to be vaccinated, your family members. And there's a lot of hot emotion on both sides of the spectrum. And we're not here. I'm not here. Henry Schein's not here. HR for Health definitely is not here to tell you what you should do one way or another about the vaccine. That's not our purpose at all. And if it comes off like that, that's not our intent. The goal of today is simply to be educational and to provide you with the information you need to make the right decisions to accomplish a couple of big things, right? A couple of very big things. One is keeping yourself and your teams safe. And I don't mean safe just from COVID, of course, although that is a big topic we'll talk about, but also safe from lawsuits and other potential claims that either patients may have because of these rules, safe from the federal government and maybe some state agencies coming after you for not adhering to rules having to do with either COVID or related protocols. And then, of course, keeping you safe from your employees, potentially bringing up claims that you're not doing enough for them in the practice. And so our goal is to educate you, to give you a ton of information so that you can take that, digest it, and then if you need help, to be able to raise your hand and say, yes, I absolutely need some help here. This is all very confusing. The information is great, but how does it apply to me specifically in my scenario? And then our team here at HR for Health can kind of walk you through this protocol. And so please keep that in mind as we go into it, because we're going to be talking about a lot of stuff. So here's the structure for today's seminar. We're going to talk about the mandate and talk to you and do an overview of that. We're going to talk about the employer's responsibility, and we're going to touch on a ton of very important questions that we are getting, today and every day from doctors and dentists around the country. So we're going to highlight those. We're going to talk about terminations and accommodations, what you need to do there if you have to terminate an employee or for a variety of reasons, but including, of course, being not vaccinated. And then we're going to talk about vaccines and hiring, and then finally next steps. And we have a couple of really wonderful announcements and surprises for you at the end, which I'll get to when the time is right. So let's jump into it, right? Let's talk about the mandate and what it really means. So there is a trend across the country whereby states are requiring all employees, and not just kind of any employees, but healthcare employees specifically, to be fully vaccinated by a certain deadline. Some of these states allow for weekly testing and some don't, right? And so that's an important point to remember, because every state is slightly different, okay? Now, what are the states that don't? Well, for example, California doesn't, Washington doesn't, Maine does not. Okay, so it's important to remember that these rules that are being set by a lot of these states are can be different from one another. And so it's important to get the data that applies to your state as opposed to sort of more generalized advice, as that won't necessarily apply to you. And we've had a lot of people come to us and say, oh, my payroll company says this and my payroll company says that, and they've been given incorrect information because whoever they were speaking to from the payroll company wasn't paying enough attention to say, oh, this person is in, Washington State, or this person is in Maine or in Texas or wherever. They were just kind of giving, generalized answers. So again, you be very, very careful about this. But there is a trend across these states to require these vaccines. So what does it mean to be fully vaccinated? As most of you know, people are considered across the country as being fully vaccinated 2 weeks or more after getting their final shot of COVID-19. And so once you have that final dose, then that is considered you being fully vaccinated. Now, again, these dates, these deadlines vary state by state. And not only do they vary state by state, but more importantly, they also can vary by city or county, as a lot of cities and local municipalities have their own regulations. So the city of San Francisco, Los Angeles County, the District of Columbia, Denver have their own unique rules regarding COVID vaccinations. And so just remember that, again, it's very localized. So you've got the federal rules, you've got the state rules, and then in some situations, you also have localized rules. And so some things to watch out for are that mandates don't always allow for testing for unvaccinated employees as an alternative, not all. Some specifics of in each county or city and state's recommendations, are so specific and so different than even the state's regulations, that we are strongly urging all of our clients and all of you attending tonight, whether or not you're HR for Health or not, to reach out and ask us for that specific information so that we can provide it to you, so you have the latest and greatest and not some more generalized advice. Okay, and so kind of keep that in mind. Now, some of these rules also apply to only state employees, state employed employees. But they are being expanded going into end of 21, 22 to include almost all private healthcare practices, which, in this situation, it can apply to you as well. All right. Now, Pfizer, as most of you know, the FDA has approved the Pfizer vaccine, and there is, a federal mandate by the Biden administration to seeing an increase in not only the number of employers that are requiring the vaccine, but seeing that terminations when employees do not comply with their vaccine policies actually move forward. And so that's something to really keep in mind. And a lot of you, I'm sure, have seen and heard what's happened with the airlines. Some airlines have mandated it and been okay. Some airlines, like Southwest Airlines, from what we understand, also went to mandated and they have not been okay. As many of you heard, there were a ton of strikes and things and cancellations in the last couple of weeks as a result of it. There's been issues with the NBA and other large institutions. I bring these up not because, of course, your office is the size of these large institutions, but what it shows us is that there's a trend and acceptance of not only having employers mandate it, but more importantly, precluding employees from either working or being terminated if they do not adhere to the vaccine mandate by these employers. And so it is becoming more of a generally accepted thing now. Is it easy for many of us small business owners, especially you as dentists, to do this? No, it's not easy. And the reason it's not easy is most of you are already seeing a shortage in hiring good employees for your teams, whether that's front staff or back office employees. So I know this is much more difficult of a decision than, let's say, an airline or the NBA or some of these other larger institutions. And that's an important thing to keep in mind as we go further in the seminar today, because at the end of the day, you've got to make the decision that's best for you and your business and your patients. And so keep that in mind as we kind of go through some of these questions in a second. So one question that we get a lot is, what if I'm not subject to a regulatory requirement that mandates vaccines? So your state, not your state, not your city, not your county, no one's kind of requiring you. The question is, can I require employees to get the vaccine if I so choose? And the short answer to this is absolutely yes. But there are protections in place for religious or medical exemptions, which we're going to talk about in more detail in a little bit. So there are exemptions for that. So what you have to consider is, I think, what OSHA recommends, which is that they consider adopting a policy that requires your employees to get vaccinated or to undergo regular COVID-19 testing. Okay. Now, this is not as a replacement for wearing masks and physical distancing, of course, assuming they're unvaccinated. So you still want to wear masks, you still want to stay 6 feet apart and whatnot, but they do recommend a policy where they either get vaccinated or they're regularly tested. All right. Now, OSHA, as many of you have heard, are releasing this thing called the Emergency Temporary Standards, ETS for short, that's going to more specifically talk about the mandate and how it applies to employers with 100 or more employees. Again, this doesn't apply for most of you who are on this call unless you're a large group practice or a DSO. But what we have seen trend-wise is that when the federal government or the state pass these rules for 100 plus employers, very soon thereafter, there's a variation of that rule, or sometimes that exact rule, that gets passed for small businesses, those with 5 or more employees. And at the end of today, one of the surprises, one of the things that I'm gonna give to you has to do with a very similar rule, a requirement that applied to 100 or more this year, but starting next year for many of you will apply to only 5 or more employees. And so as a result, again, these restrictions, these rules, they're coming down the line. They're just kind of setting, they're kind of pacing themselves, if you will. So it's not something we're going to be able to avoid. This mandate, whether or not you agree with it or not, is more and more popular around the country. More and more citizens are behind it and voting for it and agreeing with it. Although there are pockets around the country where that's not necessarily the case, and yet the states are still moving forward with this. So one advantage of being an HR for Health customer, of course, is that we provide these vaccine policies for all of you. Both the required documents and the highly recommended ones that best fit your practice. They're customized to you. So it's really important to have this transparency with your team and to be consistent, because when we do see this become an HR issue, it's when there isn't transparency, and more importantly, there's not consistency across your practices. And so just be aware of that. If you need these policies, we can definitely provide it for you. All right. Let's jump into the next section, which is about employers' responsibilities. And really here, what we're talking about is this sort of overriding, stress that a lot of us feel these days about what are my duties to maintain vaccine documentation, and how do I handle that with other medical or accommodation documents that may be coming down the pipe. And the reality is that these vaccine documentations are very important to be kept in a way that's safe. And I'm going to talk about that in a second. But what you have to kind of keep in mind is that these are medical records, right? These are medical records. So very similar to other medical records that you have, you need to keep them separate, and you need to keep them safe. And so when, the first step is, if you're going to ask for this documentation, make sure that you're asking just for the vaccine documentation and not for anything else. And so what I don't want to see, and I hope none of you have this, is a document from someone's doctor that talks about all of their healthcare concerns, right? They're diabetic and they're this and they're that, and then also talks about their vaccine status. We have seen a couple of those, and it's never a good thing to have that information as an employer. And so, what you want to make sure of is that you're really focusing only on the COVID-19 vaccine documentation in terms of whether they have been vaccinated or if there's an exemption, what that exemption is. You don't need to know why they have a medical exemption. Just that they have one is enough. Okay. Now, if there are additional documents that you get from the doctor, if I were you, if it has anything that talks about something that's not related to the vaccine, I would just reject that. Let the employee keep it. Don't even put it on HR for Health. Don't keep it for your records unless it's absolutely necessary. Okay, absolutely necessary. The next stage is the testing documents. So for those of you that are going to make sure that your employees are tested, you have a little bit more flexibility in how you handle that information. So you can definitely do it through spreadsheets or other platforms. We, of course, recommend that you use the HR for Health test result, tracking template that we have. It's a really, really great document that's easy to fill out, and it's wonderful because it has all the information you need, and you can save it electronically and into the system so that it protects you, but with the data that you need to ensure that your team is getting tested, frequently if they're not vaccinated. Now, remember what I said earlier. These are medical records. And so as a result of that, they should be kept separate from all these other files. So I hope, you have kind of moved on to the 21st century and you're not, doing things in paper anymore when it comes to HR. As most of they easily get lost. They easily, get stolen, misplaced, and all of these things. So what's important to do is to make sure you have it electronically documented, with signatures and timestamps so that there's no question when you got it and when it was uploaded into the system. So you are in a safe place, All right, let's go to the next question, which is who handles the expense for an employee being vaccinated or tested? Now, this is a hot topic, right? This is an absolute hot topic for almost everyone out there. And the reason is because, it can get pretty costly, especially if you have a lot of employees. Now, we are waiting for explicit clarification on who should be responsible for the cost of obtaining the vaccine or a test. But until that clarification comes and there's sort of no doubt about it, we are recommending that the employers cover the cost of the time that it takes to spend either getting vaccinated or tested. Now, this is not just a, Henry Schein recommendation or an HR for Health recommendation or even a my recommendation. We are making this statement because most states require, in these kind of similar scenarios, require the employers to cover the cost. And so, so you may want to weigh the options of having employees tested on site or even maybe off-site, as it might be more cost effective because, well, it's probably, it's less time for them commuting somewhere else and coming back. Your results are right then and there, and it's relatively inexpensive these days. You can get these, valid, at-home tests now on Amazon and from, drugstores and even Walmart and whatnot for, $20 to $30 each. And so there, it's not, it's not no money. It's definitely an expense, but it's also, you're not losing someone for an hour, every week, for them to drive and wait for test results and all this kind of stuff. You're doing it in the office, maybe on Monday morning, and you have the results right then and there. So now if you do, you don't want to do it in-house and you want them to, travel and get it tested somewhere else, then the time spent traveling to get the test done is easily tracked on HR for Health, and that can be tracked separately as well, so that you have good documentation of that. So there's no doubt about when they were, when they were gone for testing versus when they were actually working. These kinds of little, time tracking tips really help later on if you have a claim brought against you that you didn't pay. It doesn't all look like the same time. It's separated out. So again, we do a lot of things in HR for Health in the background that I'm describing now to you, but may not necessarily be so obvious to you or the employees because it's just a safer way of going forward. So again, hugely important. Now, what tests are appropriate to use in office versus out of office? Actually, the requirements are the same. And so the two test options are either the PCR or the antigen test. There are ones that are approved for emergency use, and you'll see them plastered all over the boxes of the ones that you're buying, again, on Amazon or Walmart or any drugstore has them. Easy to purchase, easy to implement. They can be managed by the office manager or administrator, or even potentially the team lead if you have those. So again, super easy and can be done in minutes. All right, let's go to the next phase, which is terminations and accommodations. So this is becoming a hot topic. Every day it's becoming even more and more important for the simple fact that people are making decisions about whether they get vaccinated or not. It's impacting the office. Sometimes there's a lot of in-office politics that's impacting this, where some people are vaccinated and they want everybody to be vaccinated. And some people aren't vaccinated, and so there's a lot of stress that comes, and so topics of termination and things are rampant right now. So one of the questions is, what do I do if an employee refuses to get the vaccine? So when an employee refuses to get the vaccine, we right off the bat initially recommend that you engage them in a conversation to truly better understand why, or what the employee's concerns are and why they're not getting it. And if maybe there's a qualifying accommodation that might be needed. And so that conversation is a very important one to have with your team members, because sometimes you can uncover a lot of things and as a result of that, be able to talk them through it. Now, I don't necessarily think that, people's minds will get changed about getting the vaccine or not. But it is, I think, important to talk to them about the safety of your other team members. There are a lot of situations where, you may have employees with elderly parents that they live with compromised children, parents, themselves, spouses. So we don't necessarily know the whole breadth of, someone's family situation sometimes. But if your employees are just choosing not to be vaccinated for personal reasons, but it has nothing to do with medical reasons, has nothing to do with religious reasons, which we'll talk about in a second, then I think educating them on that and how their behavior may impact others, may be an important thing to do, as it might impact their decision making there. But if we're talking about a qualifying accommodation, we're really talking about two: either it's a disability or a religious reason, right? So those are the two qualifying, accommodations, if you will, that you have to keep in mind if someone's, potentially refusing the vaccine. So, so if they do refuse it for one of these two reasons, again, we ask you to engage them in the interactive process to determine if there's a reasonable accommodation that can be made for them. This is, it's important to remember that these are covered by a disability, or, people who are covered by a disability or a religious reason are protected under the law and shouldn't be terminated. I know a lot of you have gotten some bad advice from others who have said that it's okay to terminate those employees, but I can tell you it's a easy path to a lawsuit. We've seen a lot of them. I mean, we've been successful in defending it, of course, because we go in hard and we've got a lot of great information, especially to their HR for Health clients. There's usually good documentation, but the lawsuits can still happen, and the goal is to avoid those, right? The goal is to avoid those, not just to win, after spending months and months and a lot of time and money there. So don't retaliate against them, don't terminate them. It is a protected leave, and so just kind of keep that in mind. No matter how upset you are, give us a call and we'll kind of walk you through that. Now, if it's not a disability, if it's not a religious reason, but rather it's just a personal reason, right? And this is something where it's a personal decision. They have just decided not to get the vaccine, for any number of things, right? Whether they think it's fake, whether they think there's a chip in there, whether it's by aliens, or any number of other reasons that they have. If it's just personal, it has nothing to do with disability, has nothing to do with religious, then it's important to also open up the lines of communication and have this conversation with them to see what their specific concerns are. I think that never is a bad idea, especially as sometimes it might ease the anxiety that lives there. But at the end of the day, if they still refuse to get tested, which some are, right? So they're refusing the vaccine. They don't have a disability or religious, reason for it. This personal reason, but they're also refusing to get tested. Then in those situations, you can either terminate them or put them on unpaid leave. Now, those things should not be taken lightly, so you do need to talk to a professional. So if you're on this webinar and you're an HR for Health customer, please pick up the phone and make sure you talk to one of our experts. That's what they're there for, and they will coach you through that. If you are not an HR for Health customer, make sure you get in touch with them so that they can help you, navigate through this process, because it is a very, very, very difficult thing to do when you're thinking about letting go of somebody who maybe has been with you for a while, but are refusing to get tested and are not getting the vaccine either. And so it just puts you as the employer in a really kind of precarious situation. Okay, now let's move on to the next question. How do I navigate the medical and religious exemption request process, right? So now you've gotten this request. What do you do with it, right? What do you do with it? Now, remember, in this scenario, the employer is refusing the vaccine due to disability or religious. And like we talked about earlier, you have to engage in the interactive process, right? So we'll take them one at a time. Let's talk about the disability accommodation first. So step one, right? The employee has to fill out a vaccination declination form. Okay, HR for Health has an awesome one. Make sure you get that from us, and they write down in that why they are declining the vaccine, right? Why they are declining the vaccine. So that's important. Step two is that they have to provide some medical documentation, right? So they have to provide some medical documentation, usually from their primary care physician, to support the need for a reasonable accommodation here. This is important for you to have. And remember, you take that information and you put it in HR for Health in a safe place, but that's for a disability accommodation. For a religious accommodation, the employee, step one, again, has to fill out the vaccine declination form, noting the reason for declining the vaccine. And then the question might be, well, what do I need to get from them for a religious exemption, right? And the thing with the religious exemption is that there's really not a document requirement here. We are generally advising that if an employee is basing it on a sincerely held religious belief, that you accept that. What does it mean for something to be sincerely held? That varies. Everybody has their own standard on what they think is considered sincerely held. Could somebody change religions due to COVID and now have a sincerely held belief? Yes. Could somebody go pay a church, a certain dollar amount for a letter that says, they've got a religious accommodation? Yes, we've seen that happen as well. We've seen a lot of crazy things on there. So I think, although, you can challenge it if you want, if you have evidence showing that it's not sincerely held, for the most part, we are advising that you be careful about that and avoid questioning the sincerity of it, because it's so risky. And so just kind of keep that in mind. Of course, the safest route, as I mentioned, is to avoid requesting any more information, because then you just don't open up these cans of worms, right? And so just kind of keep that in mind. But as I mentioned earlier, and I'll mention it again, make sure you don't retaliate against them. Make sure you don't terminate them if they have either one of these accommodations, right? Any one of these accommodations. Now, I know some of you will ask us maybe at some point, well, you know what, I hear, basketball, players are being told that they're going to be suspended because the teams didn't believe that they were, avoiding the vaccine because of religious. They challenged them and nothing happened. And there's a lot of stories like that out there. And that is true, that there have been a couple of players in the NBA who were, the teams challenged their religious held beliefs and they were successful. The teams were, and there was no harm. What I want to caution you about in those situations is that those facts are different than what applies to you. The NBA is governed by collective bargaining agreements, so there's a lot of more complexity that applies in those scenarios than in a typical dental practice. And second of all, they have a lot of deep pockets, and those contracts that they sign with those players are drafted in a very specific kind of way to protect the team as well. You typically don't have that with most of your team members. Your front desk, hygienists, back office, RDAs and DAs, even your doctor associates. And so it's a totally different world, right? You're living in the small business world, and they are in a sort of the big Fortune 1000 type of world. And so as you hear these stories around the country, and so did this, and so said that, I would urge you to try and take a moment to see, how close of a situation that is with yours, and whether that information is correct, because sometimes people embellish and whatnot. The best thing you can do is to be part of HR for Health, so that you have access to our experts, so that you can raise your hand when you have a question and let our team answer those questions factually with information that's correct, versus kind of stories that may or may not be true. Okay, that may or may not be true. So just take that from me, having seen a lot of cases in these last years, that these stories tend to be embellished a little bit. All right, let's move on to the next thing, which is, what if my practice can't afford to make the accommodations for these employees? What do I do then? And this is a very real thing. Because a lot of you have been impacted one way or another by COVID. Some parts of the country are still hurting when it comes to seeing patients. A lot of patients have not come back. There's been a lot of great stories about people who are doing better than they were doing pre-COVID because of the move from big cities to suburbs. But there is this component of, what if you can't afford it, right? What if you can't afford it? So if accommodations really aren't possible, and an unpaid leave of absence is not an option, or furloughing somebody is not an option, then you do have to kind of think about what your options are. And the reality is that when you furlough an employee, right, they're still part of your team and your staff, but they're still simply not working for you. They're simply not working for you. So as you kind of think through, whether you can truly afford it or not, or whether accommodations are possible, there are some, your options really are, either you terminate them, which sometimes is not a good idea. You either, you put them on an unpaid leave of absence, which might turn into a termination. So you got to be careful about that. And then furloughing them, which also could turn into a termination, but could be a potential possibility. What I want to make sure everyone knows is that not being able to afford an accommodation has to be more than just a inconvenience, right? We know it's going to cost money, but if it's just an inconvenience, that's not enough, right? That's not enough. It has to truly impact you to a level that might, take the business under, or may require you to fire an employee, or significantly change your operations to the detriment of the business. Those kinds of things are the reasons why an accommodation may not work, right? May not work. And so just kind of keep that in mind. Now, HR for Health has an amazing letter template that you can use for noticing or for noting the changes of employment status and whether it's furloughing or otherwise. So again, if you need resources on that, this isn't something you want to just kind of make up. We've got some awesome documents for you. All right, let's go into the next phase, which is vaccines and hiring, right? Vaccines and hiring. So one question we get is, can I require the COVID-19 vaccination as a condition of employment? So the answer to that is you can require it as a condition of employment during the hiring process, but you've got to be very careful about how you do it and when you do it and whatnot, right? And so we're going to talk about that right now because the timing of it all is very important. So the first thing is that you have to show and demonstrate that getting the vaccine, right, is relevant and pertinent to the job. Now, that applies to almost everyone here who's listening to this message, right? Because you're all dentists, you have dental practices. And so for 95% of you, every one of your employees would qualify for this first, requirement, which is, can you demonstrate that obtaining the vaccine is relevant to the job? Well, of course, yes. You're in people's mouths, you're interacting with them, so on and so forth. You should, you qualify. The 5% that don't are if you have, at-home employees or out-of-office employees. So if you have, let's say, your telephone support and payroll person and marketing person and insurance person, and they're sort of off-site and they have no interactions with anybody and whatnot, then in that situation, for that position, then you may not need to require it because they're not really interacting with anybody else. But for your typical dental practice, typical positions, clinical or front desk, this absolutely applies. The key is really to be consistent, right? You want to be consistent in your hiring. So what I mean by that is that if you're not gonna ask your current employees about their status, then and you're not gonna mandate it for the current employees, then you got to be careful about whether you ask applicants to be vaccinated, right? So if you're going to ask your current team to all be vaccinated, and that's your protocol, and you're going to terminate people, or if they're not, for as an example, then it's okay. But you can't, kind of double dip and make exceptions, when you're doing your hiring. And so whatever you do for your current team really should be what you do for the rest of the folks that you're looking to hire. You do definitely want to be careful about the questions you ask in terms of hiring. And so just make sure that you are not getting into any ADA stuff, but rather you're focusing on, just COVID reasons. You don't want to get into disabilities or other medical reasons that they may have, as that, that just will open up sort of a can of worms. If you're going to condition a job on the vaccination status, that could also lead to some accommodation requests, as we just talked about. So again, just be careful, with disability questions, religious-based questions, because if you start going down that road, those, prospective employees could ask for, could claim discrimination in hiring as a result. So my recommendation is that you ask about vaccine status after you've given someone an offer of employment. So after you've done your interviews, you're not asking any questions about vaccines, you give them an offer, and then in that offer, in there, we'll say, hey, we're going to do a background check maybe, and so on and so forth. And then one of the questions is going to be, or one of the things is, please provide your proof of vaccination, and things of that nature. And so you want to do it post-employment, right? Post-employment, because then at that point, if you do have a policy in place that all your employees have to be vaccinated, then nobody can claim discrimination because you offer them the job, but hey, this is one of your policies in the office. Okay, so just make sure you're not asking it during the interview process, and again, only after you've given the offer. Make sure it's in the offer letter. Okay, make sure it's in the offer letter. Now, my recommendation, again, for those of you on HR for Health, make sure you put the these documents that you're getting put them in the HR for Health portal in the documents section. Make sure it's there, make sure it's protected so that there's no question about what you're asking, these prospective employees, because sometimes they do come and they claim things that maybe aren't so true. Okay, as we get to the end and the surprise I have for you, I want to talk about next steps, because as most of you, if you've seen any of my other seminars, we do this in a variety of different ways. I think being here and listening to this and is super helpful and valuable, of course, but what you do next is even more important, because otherwise, what was the point of listening to all this if you're not going to actually take steps to make yourself better, make the practice safer, and protect your family and your investment from lawsuits. So right off the bat, what we want to get is you need to have a COVID-19 vaccination policy. Even if you are not requiring it for your employees, make sure you get one of these. Okay, make sure you get one of these. This is very, very important to have both in your employment manual and also separately. Okay. The second thing is you need a COVID-19 vaccine declination form. That's for anybody who says they will not be taking the vaccine and whatnot. And so remember, you need them to fill that out, tell you why, and then you kind of go from there, depending on whether it's a religious or medical exemption, as we've gone through tonight. Okay. Make sure you have your religious or medical exemption protocols in place. If you don't know what to do, even after tonight's seminar, make sure you talk to our team at HR for Health so we can guide you through this whole thing. Again, super, super important to have a consistent protocol that you keep going back to across the board for everybody. Make sure you document the protocol for test results and vaccine statuses. How you handle that is important, as we talked about. Make sure you are putting it somewhere secure, under lock and key if you're doing it in paper, but please move away from doing it on paper. Most of you are paperless. You've gone, in that platform, to go paperless for your charts. Why are you still doing your HR, which are so important for your team? And of course, what's happening now in the world, why are you still doing this in paper? It just doesn't make sense to me, especially since they get lost and destroyed and stolen so often, right? These are your get out of jail free cards. So make sure you get these in a safe place and you upload it into HR for Health so that it's secure and that no one can touch it. Make sure you have a hiring protocol when you're interviewing, that you have offer letters, you have things in place for conditions of employment after an offer letter has been provided. Even though it's an easy topic to converse about with prospective employees, try to avoid talking about COVID-19 and vaccine statuses. And then finally, communicate with your team, right? Communicate with your team. It's vitally important that they know what's going on. Everyone should be treated equal, but we understand every office could be a little bit different. And so, what's good for your neighbor may not necessarily be good for you, but that's the beauty of a system like HR for Health, because we can customize it for you. Remember, everyone, this is a super, super tough time for everybody, employers, employees, their family members, patients, and keeping that line of communication open and transparent is hugely important, and so, I know that, not everyone will get vaccinated all the time, and you may even not be vaccinated, but that doesn't mean that these policies don't apply to you. And so it's important to keep those lines of communication open so that everyone's on the same page. Obviously, HR for Health is here to help you by helping with this communication, by giving you the tools you need. We provide the transparency, the documentation, and of course, making sure that not only is the team informed, but the practice is safe. Remember, HR for Health was built with the practice in mind, right? It was the practice in mind, so to keep you safe. So that's our goal there. All right. Now I've got a couple of great surprises for you. So now remember what I mentioned or not last year, but earlier this seminar. There are rules being passed around the country regarding certain things having to do with COVID-19 and employee statuses, employee benefits. As you know, more and more states are putting policies in place for sick time and sick leave. mandating this, that employers have to provide it. And just like some of these other rules that we've been talking about, they started by saying that employers with 100 or more employees have to provide it. And then it went down to 50, and now it's every employee of every employer in many states. And so, this is spreading across the country. Well, there's a new phenomenon that's happening, which is that the 401ks are the same thing is happening with 401ks, and the governments are now, the federal government and also state governments are passing rules requiring that you provide 401k to your employees. Now, this again varies state by state, but one thing we know is that it is, being pushed hard by the federal government and may, come to pass sometime next year. But we definitely know that it is, for small employers of 5 or more, this is going to be a rule in many states, including California, starting next year. And so what we have done at HR for Health is we have done something that is unheard of in the business, which is we negotiated the biggest and the best rates in the country when it comes to 401k. And now we are providing this exclusively to HR for Health customers. And because of our relationship with Henry Schein, we are doing an early release for all of you who are on this webinar, because what we know is that it's coming. And so we are taking names right now and applications, and we are getting people ready. Not everyone's going to get in because we already have a waiting list. But I urge you to get on this train, because when things happen, they're going to happen quick. And right now we've got, the lowest rates possible. And so we have clients that are saving, some are saving tens of thousands of dollars. Like we've had a couple that have been $30,000, $40,000 that are large institutions, but most people are saving, thousands of dollars on this 401k business. And all it is fees. That's all it is. You still get the same plans. You still get the same benefits. The employees get the same things. You get the same things. In fact, you get more, because we're providing fiduciary duties and benefits to all of our 401k customers, which most of you do not get with your provider. So it's an added layer of protection for the employer. So basically what that means is that the employees cannot come back and say that you violated their rights by giving them plans that charged them too much or didn't give them certain options. The fiduciary kind of protection lays over the 401k and makes sure that you are safe. But the rates that we're getting, it's the lowest in the industry. Literally, no one has beaten it and no one will beat it, and you guys get access to it. So make sure you contact someone at HR for Health for that. If you're already a customer, make sure you reach out so you get on that list so that we can get you in coming into next year. We're going to really start rolling it out in January. And so the sooner you get on, the sooner you'll have access to that. And it's complimentary. It's part of what our service is. So we're super excited to be able to give this to you guys. For those of you who want some of the forms and policies that we've talked about, the second surprise we're giving this to you as well. If you take a picture of this QR code on your phone, you'll see a link pop up, and we'll be able to send this to you in your email. So all the things we talked about a few minutes ago that you need to have are not just nice to have. We're stuff that we're giving you again as part of our gift to you and our relationship with Schein. So make sure you take advantage of this, and remember, the reason we're giving you all this is so that you can realize that there's a lot of things out there that you need to do. And there's a lot of things that you need to monitor and handle. And so let us help you kind of do this. Let us help you kind of organize your thing. It's minimal cost for the benefit that you get and the peace of mind that you get. So make sure you reach out to one of our team members. Here's the link if you'd like to get in touch with one of our team members to help you with everything. They can answer any questions you have, get you started. And if it's a good fit for your practice, then we are here to serve you. So make sure you take advantage. All right, Adam, that's all I have. I see that we do have some questions. Do you want to ask them, or do you want me to go through them?
Go for it.
Awesome. All right. So I'm gonna go. I see we got some in the chat and some in the Q&A, so I'm gonna go through these. Yep, I see a couple of comments about refusing to get the vaccine. I totally get it. It's your personal decision. It's one of the beauties of being an American is you get to decide. And so I will not talk about the pros and cons of it because everyone's going to do this based on their own decision. So we'll skip that question or that comment. Let's talk about the next one is if someone has a medical exemption from vaccination, do they have to undergo regular COVID testing? Do they have to undergo regular COVID testing? So that's a really good question. So if they have, depending on the state that they're in, if they have a medical exemption, we are recommending that they do get their testing. The exemption is for the vaccine, but they could still be carrying COVID-19. So you need to test them on a weekly basis at least to ensure that they are not carrying it and they're not going to spread it to the rest of your team. So the answer to that is yes. We are recommending that you have them be tested, and most states right now are requiring that as well. Right? They are requiring that as well. Okay. All right, so the next thing is, are vaccines required in New York in private dental offices right now? I was under assumption that right now, no. Am I wrong? So I'm gonna have to get back to you on that in terms of New York. And I don't know if you're talking about New York City or the state of New York, but we'll get back to you on that, Deidre. Adam, can we get Deidre's email and I'll have somebody at HR for Health get back to her on that?
Yep, I'll download the report and send that over.
Okay, awesome. Okay, perfect. Can an owner dentist claim a religious exemption for the entire practice? No, you can't. This is a personal thing that needs to be done by each individual, and so you need to have that documentation. Can you have a grandfathered employee refusing the vaccine, but now change the policy to require it for all new hires? So great question. So you remember we talked about consistency. So the answer to that is no. You want to make sure that whatever you're requiring of the new hires, you're also doing of your existing employees, unless of course they fall into one of these exemptions that we're talking about. So although it would be really nice to do that just with the new employees, you run into issues of discrimination when it comes to that. So I would say, treat your current employees the same as new potential employees. So if an employee has had COVID, are they still required to be vaccinated? That depends on your state. Usually if someone has had COVID for a period of time after it, we've heard different things in different states, but usually, they say if 8 weeks, for the first 8 weeks, that they don't need to be, vaccinated, and they in fact shouldn't be vaccinated because they've had COVID. That being said, if their primary care physician says that they're beyond that timeline, then yes, they should probably get the vaccine at that point. There is this false understanding that if you've gotten COVID once, that you're immune for life. And the reality is that we're seeing people who have had COVID, get it again and whatnot. And so the answer is yes, there is a little bit of a grace period there because that's a medical exemption because they've had COVID. But then after they get better, then they and the 8 weeks has passed, then at that point they should probably get it if it's required by your state or city. And so are vaccines required in California for dental office staff? The answer is yes, unless she's in California, by the way. So the question was someone from California. Yes, for dental office employees it is, unless they fall under the exemption that we talked about. So those were the Q&As, but there's a whole bunch in the chat that I want to go through as well, because I think some people put questions there. Is a presentation going to be shared? I don't know, Adam, if we're sharing the presentation or not. But the video definitely you'll get again. So if you want to listen to me again, you'll be able to view that. I think we answered the question about new hires that was asked. Again, treat new hires just like you're treating your current employees. Let's see. Okay. New documents. Okay, good. No, I think this is all about more administrative stuff about whether or not the presentation is going to be provided. Continuing education. Adam, I don't think continuing education is being provided, but maybe I'm wrong.
No CE.
No CE. Yep. We talked about state and federal government. Yeah, 401k information for you, Chelsea. We'll definitely get that for you, or just reach out to us and we'll make sure you have that. That's very, very important. And do you have
an HR for Health email address?
For the
just the general contact line.
Yeah, I would say the general contact line is probably the right one to use for that. Yeah, or reach out to me and then I can get you to the right person. I'll put in my emails so that everyone has it in case they want to talk to someone. Let me make sure I'm spelling this correctly here. There we go. So that's my email, everyone. If you want to just email me, I can make sure you get contacted with the right people. And I think that's it, Adam. I think that's all we've got in terms of questions. So I want to thank everyone for being here. Again, don't hesitate to reach out. That's why we're here, to answer your questions. Make sure you talk to HR for Health as well, for these documentations, and hope to see you guys soon.
Awesome. Thanks, Ali. And to clarify, we did record. We'll send out the recording. We will not be sharing the actual presentation. And you can get that in about 1 week. So thanks for attending. Have a great night, everyone.
Good night, everyone.